My name is Sally Basta. I'm a physical therapist with C4K's. Well, I think the original idea for building this program initially was to create better access. A lot of times when these children were referred to physical therapy out in the community, it would take 3 to 6 months for them to be seen, and sometimes a waiting list to get back in once the evaluation was taken. So the idea of building this was to have a program under the same roof that was able to get kids in right away, because when they are referred to therapy, it means that they need therapy right now, not 3 months from now. So we've thankfully been able to successfully create a referral process that allows kids to be seen within a few days of that referral being put in place. We mostly treat the oncology and hematology program patients here, but we do occasionally see some of the oddballs that kind of flow through, just so we can create a great continuum of care within the program. Yeah, I think most physical therapists go into this career in an effort to prevent problems from ever starting, but unfortunately in traditional models of care, you are oftentimes providing reactive care to an injury or to problems that have already begun or have existed for quite some time. So another thought process of getting a PT program in-house within C4K's was to get children in early and prevent problems before they could even occur. If we can get an evaluation in before a child begins to receive chemotherapy, hopefully we can keep them active, keep them walking, keep them out of a wheelchair, and keep them doing what they enjoy doing. Yeah, you're absolutely right. When I started here, it was a very unique experience where we honestly just picked a room somewhere in the building and brought in a few pieces of equipment and did what we could in a small, tiny treatment room. So it's been wonderful to be able to provide such a beautiful space to treat our children in. We are very thankful for our donors who were able to make this happen. Again, we are just right down the hall from where the physicians are and where the children are already getting treatment, so it provides really easy and quick access to people. We try and see them either before or after their already existing appointments. So the proximity here and our relationships with the physicians that are here really make it a very seamless process for our patients and their families. So we are very lucky here to be able to provide direct one-on-one patient care with all of our families. So ultimately that means that we do see a little bit less than the traditional outpatient practice, typically between 7 to 9 between myself and my coworker. But all of that care is one-on-one. You are always seeing a physical therapist, a licensed professional for the entire time that you're here. I would say that our profession is pretty highly misunderstood a lot of times, whether that be someone had an experience before that wasn't typical or just from what they perceive from the name. A lot of times people assume that we are going to be running miles or doing massage therapy techniques or whatnot, and that's not always the case. Physical therapy and preventative medicine is very much targeted towards the individual. We may have one child that we are trying to get out of a wheelchair and walking again, and we may have another one that is trying to get back into college level baseball. And so all of our treatments are going to be directed towards the individual person and what their goals are. Sometimes we unfortunately have children that have a really rough go of it upon diagnosis, and they may be in the hospital for months upon months. As you can imagine, if you are confined to a hospital bed for some time, you will experience muscle atrophy, muscle contractures where your joints don't move as well. You may be confined to a wheelchair due to those limitations or pain. So we've definitely had a few kids that we got going from a wheelchair and just, let's get you stronger. Let's start with the basics of things that you can do at home to get these muscles moving again and your joints more flexible. And typically we see those patients a little bit more regularly than others, so it can be 2 to 3 times a week or just weekly based on of their medical appointments. But what we stress is what you do at home. You can see therapy every single day, but if you are not doing a home exercise program, you probably are not going to see the benefits that you want. So our patients that are really successful are the ones that take everything we say and implement them at home as part of their daily routine.